Hey, my estheticians, this is Dr. Cash here. I know it's been a while since I've posted, but it's for a good reason. I have been working very hard in creating an online course for estheticians to help them pass their state board exam the first time. You guys work so hard, and I still don't understand why 49% of esthetician students fail their exam the first time. So I'm hoping that my online course will help you pass with flying colors the first time around. And that way you can focus on what you actually went to school for, and that is to help your clients get the best skin possible. I want you guys not only to be professionals in this industry, but to become leaders so that other students and other professionals can follow you. So I am going to make a personal promise and say that every week I am going to post videos that will talk about certain difficult topics in the My Lady book for estheticians and professionals out there to review. I hope that this helps. And if you want to hear some certain topics, let me know and I can definitely try and address them in my upcoming videos. All right, let's get to it. Basal cell carcinomas are the most common type of skin cancers that you will see and the least aggressive of the three that we will talk about. They're usually defined as pearly looking, red, raised with round edges. And sometimes even blood vessels can run through them. They're mostly on the face, in the T-zone that you will see. And they usually grow and invade locally. They don't usually metastasize or spread throughout the body. They just locally invade. Once you diagnose this, you can send them to your medical professionals and they can take a look at it and see how they can remove them with various different surgical techniques. Squamous cell carcinomas are usually crusty, and sometimes they can be pink, but usually they look like non-healing wounds. So think of a client that comes in and they say that, hey, I got this lesion on my face that it goes away but comes back every time I clean it, or it just tends to keep growing and it looks like a crusty sandwich. You should be thinking about squamous cell carcinoma in this instance. Something that is non-healing or keeps coming back with some vengeance, think about cancer. That's your sign or your opportunity to diagnose something that could save a patient's life. Squamous cell carcinoma in general is not as aggressive as melanoma. However, it can still spread throughout the body. So let's talk about melanoma now. Melanoma is the most serious of all the skin cancers that you're going to see. Like I mentioned before, it's fairly prevalent, so don't be surprised if you actually diagnose a melanoma. Now, for melanomas, given the fact that they are so serious, the American Cancer Society has come up with a mnemonic, or a way to remember and identify these lesions is by using the mnemonic called ABCDE. A stands for asymmetry. Now, a mole, for example, is going to be nice and circular, but asymmetry means that the two sides do not match up. Something's wrong or something's off. B is borders. It doesn't have well-defined borders. It will have borders that are probably jaggedy or abnormal or asymmetrical looking. C is color. Usually melanoma becomes darker and darker as time goes by, or darker compared to the other skin around it or other moles even. D is for diameter. Usually melanomas can be about 1 millimeter or so big. They can come in various sizes. E is for evolving. Evolving means that is it growing over time? How is it changing over time? Etc. So that's where it's important to ask your clients, when did they notice it? How long have they had it? Is it bleeding? Is it causing pain or discomfort? Have they noticed any other lesions such as this? And that's where you can get your history and try and diagnose a patient with skin cancer. Once again, estheticians, you will have the opportunity to help your clients not only with their skin health, but hopefully prevent cancer in them or even diagnose skin cancer and get them to the right medical professional so that they can be cancer-free. If you guys have any questions or concerns or need clarifications, please go ahead and drop a comment below and I'll make sure that I respond to it and get back to you as soon as possible. Look out for my weekly videos and let me know if you guys want to learn about other skin conditions. All right, I'm out.